Okay, so what is HHS?
Something
Hyperosmolar, something state. I don't know. Not super important. Which type of diabetic does it most commonly happen in?
Type 2.
Type 2. Does anyone know why?
Is it because of the obesity, like them being overweight? No.
Not really. It actually is because they're older, usually. HHS is characterized by the blood glucose over 600. And the reason being is because people their insulin gets low and they'll start to get hyperglycemic, but they just kind of push off some of those signs and symptoms of like, I'm just old, or just tired, there's nothing wrong, until it gets like really, really bad and they end up in the hospital. And usually HHS happens when they're undiagnosed. So this is how they discover that they now have type 2 diabetes. They'll come into the hospital in this like state, almost in like a coma. So it's more common in type 2 diabetics. The reason that they don't get ketones like DKA is because their body, like the insulin, never gets so low that their body feels the need to go into that starvation mode of like, I gotta break down some fatty acids first. So, and that's why also it usually happens in type 2 diabetics, because DKA happens in type 1 diabetics. And it's because they don't even make insulin. So if they forget to take their insulin, they're gonna have like a severe drop in insulin levels. Does that make sense? Yeah. And that's why they go into diabetic ketoacidosis, because they don't make insulin, and if they forget to take it, it's like a sudden drop. Their body goes into starvation mode, and they break down fatty acids to make ketones for energy.
And your acid level goes up.
Yeah, and you get metabolic acidosis. So does that kind of help you remember the difference, like why they get HHS versus DK? And the blood sugar is much lower. Like they have symptoms earlier on in their hyperglycemia.
Wait, which one does?
DKA, like it's around 240, 300 and stuff like that. So, but they both kind of end up being the same. Like they both end up being hyperglycemic. They both end up having problems with potassium. They're both dehydrated, and you treat them the same. You give insulin, you give fluids, and then you maybe might have to give a potassium supplement. So, why does someone with HHS pee like everything out? Why do they start peeing?
Because their body's just it's so high.
Yeah, because their glucose is so high, the osmolarity in their body is so high that their body goes into osmotic diuresis and just pees, trying to get rid of everything. Same thing with diabetic ketoacidosis.
Blood pressure.
The only difference is these people usually already are dehydrated, and that's why they get HHS. This one ends up causing dehydration. So they both end up dehydrated too. Like either way, whether they had it to begin with or they got it because they had this disorder. And so IV fluids for both, and insulin.
Their blood just becomes super hypertonic.
Yeah.
So it just sucks all the water out of their cells.
Usually in the acute phase, it's an IV drip. And then once the patient is stable, you can do sub-Q insulin. So IV drip when they're... Does that kind of help differentiate? That's the main thing. I mean, the main thing is just knowing that this one has the ketones and this one has no ketones. But just memorize your signs and symptoms of hyperglycemia, because they're both going to have the same signs and symptoms. The only differentiating factor is the blood sugar level and the ketones versus no ketones, or maybe she'll give you like they have had diabetes their whole life. Then you might be like, okay, maybe they probably have this, or if they don't know they have diabetes, maybe it's HHS, or if they have type 2, you know. That's really it. I would just look at the differences, because they're really, really similar. Okay. Like even in this book, we were looking over some of the questions for them, and it mainly just tested you on the differences, because they're treated the same, that kind of thing. So does that answer all your questions about that?
So yeah, thank you.
Okay. Anytime we give insulin, we're at risk for making someone hypokalemic, because insulin forces potassium into the cells, remember? One of the treatments for hyperkalemia is insulin and glucose. So, yeah.
Insulin forces potassium into the cells.
Yeah.
Yep, exactly. When insulin goes to the cell and it pulls a glucose in, it pulls a potassium for some reason with it. So it just takes the potassium with the glucose into the cell. So, yep. And with DKA, they're peeing like a ton.
Yeah.
And that also can cause low potassium because of the just peeing out everything. Because our body's trying to flush out all that extra glucose and it just takes the other stuff with it. So yeah, potassium might be a problem you guys might have to fix. What's our mnemonic for hypokalemia?
Basic
Low
walls.
potassium.
No. Yeah.
It's mad
Madwich. Yeah, Madwich.
Yeah, I think arrhythmias, or is this
Oh.
arrhythmias?
Yes, I think so. Muscle.
Decrease, DTR,
Decreased bell sounds.
yeah,
Weakness.
weakness, irritability. Can't remember what T is.
Tingling.
Tingling, paresthesia.
Chronic fatigue. And